am a pediatric hospitalist, which means I take care of children who are hospitalized. And I also work in the pediatric urgent care, so I take care of kids who are acutely ill. I am at Kaiser Permanente in Seattle, but my inpatient hospital work is at Seattle Children's Hospital through Kaiser. And certainly the last few months have been really unlike any other clinical experience I've had as we all navigate through this ever-changing landscape, ever-changing news about how to best take care of patients and how best to triage people and protect ourselves and protect our colleagues. So it's been really interesting, and I think pretty much every day has been a little bit different as we figure out how to do this better and do our very best to take care of people. It's very easy for kids to get scared, and I certainly have seen patients who are very stressed and anxious, and it is a really anxious time. There's so much we don't know, and it does change, frequently. So trying really hard to focus our kids on what we can do and what we know, what we don't know. And we know the things we can do to help prevent the spread of coronavirus includes social distancing, staying home, finding smart ways to learn at home, hand washing, covering our coughs, things that we don't know are, how long this is going to last, but we know that we're in for a marathon and we're trying to keep up with healthy habits and I guess teaching them to be comfortable with a little bit of uncertainty, but recognize there are things we do have power over. I feel really well protected at the hospital I work at. That being said, recommendations have changed over the past 8 weeks. So we have gone through a variety of recommendations on what we need to be safe. I mean, if you believe it, back 10 weeks ago, wearing masks wasn't normal. Right? So, I mean, we have really evolved, but, I mean, we constantly, at all the places I work, we follow the Center for Disease Control guidelines, and I feel like we've got what we need. We really have to be judicious about it, and sometimes we reuse things. That's true. Honestly, I have a big Ziploc bag in my work bag that has masks that I have used before, but I have them with me because I don't want to get into a situation where I don't have what I need.
It's better than nothing.
So far I haven't. But people are very cautious. I mean, you are given like one a shift or one, and so you really have to be careful with it. Can't be thoughtless and leave it around. One thing I worry about, though, and I think everybody worries about, is this is not a sprint, it's a marathon. This will go on for a long time, and I think there's going to be relapses and remittances and resurgences, and this is, we're just adjusting to this new way of learning, working, living. So on the good side, a lot of patients are being cared for by video visits and phone calls and online chat visits. That's not something I can do, but that's something that a lot of my colleagues do. And this is probably something that will remain even after COVID is under control and we have a vaccine. And this is good. And this might really be transformative of healthcare. So, and maybe, I mean, COVID is not good, but this is maybe one positive thing that's coming out of it. Even in the time of COVID, people are still getting sick from other things and having accidents for other reasons. So not everything is COVID. And sometimes I feel like it's really easy to see everything through a COVID lens. But, there are kids with underlying medical issues, diabetes and seizures and asthma that need to come in. There are newborn babies that get sick. There are accidents. So, we still see all of that stuff. But if you step back and take the 20,000-foot view, our actual number of patients are down right now compared to where we were a year ago. And I think that's because we are having lower transmission rates of other viral illnesses. But still, I mean, it's so scary for patients and for kids, particularly when they are seen in the ER, admitted to the hospital, because the first thing everybody is worried about is COVID, and it's, it's the first thing we check for too. So one thing that's really helped is the rate of the turnaround time for the COVID test is now down to 4 to 6 hours.
Oh, wow.
And so we can answer that question quickly for people. It doesn't mean that they can go home. They may still need to be hospitalized, but at least we can let them know yes or no. And that's helpful. That's so helpful for families and providers.
If we could focus first on the state and any regional as well, how have their reaction to the crisis been handled, and how do you kind of think about this?
I live in Washington State, and
yeah.
I am so proud of our state. I think we've done a really good job.
Great.
I really do.
Does it keep in line with what you learned you said you had a public health degree?
Yeah. I mean, they're just doing it. They're smart. They're getting the right consultants. They're following the science. They're following the evidence. They're making really, really hard decisions, but I think it's for the greater good. I'm so proud of our state. They're very consistent in their messaging. They're doing a good job, I think. I really do. I really do. I think we just need to remember that this is a marathon, not a sprint. We will get through this, and that we all have to take care of ourselves and each other. And as much as we can, stick to our own personal healthy habits, whether it's, trying to get some exercise, whether it's trying to do things to relieve stress, whether it's, reaching out to somebody who might be truly isolated and not living with the family. I think this is a time for us to step up, and people really are. So I just encourage people to continue that. Well, I never take selfies. I'm not a selfie person. But I have to tell you, I took one selfie the first time I put on my whole, it's called a capper. I don't know if you're familiar with those. You wear a mask, a gown, gloves, and then a helmet that has a battery pack on your head.
Oh, wow. That sounds intense.
It's really protective, but it is so hard to hear, and it's heavy, and it blows air in your ears, and it just makes suction cups on your face. And I was thinking, this is really strange. I look like a Martian. I'm walking into a patient room with a little child, and here I am looking like a Martian. And so I did take a selfie. I was thinking, wow, these are very odd times as I walk down. In my head in that helmet is bigger than most babies I care for.